Keloids, a very common skin concern but can be very stubborn when it comes to the treatment. Hi, this is Dr. Priyanka Reddy, and in today's video we will be discussing everything about keloids. If you haven't subscribed to my channel, please do, and if you find the videos informative, do share it with your family and friends. Keloids for some is only of cosmetic concern, but for some it is more than just a cosmetic concern, as it can become very itchy, painful, and also lead to restriction in the movements. So what exactly are keloids? Well, when your skin is subjected to any trauma, for example, when you get your ears pierced, you fall, or you undergo a surgery that has scarring, what happens is there are certain cells in the body called fibroblasts that come to heal the wound. So sometimes, because of unknown reasons, deranged healing mechanism, fibroblasts tend to be overactive and lay more scar tissue. Like for example, if you are placing bricks together, you need to lay a certain amount of cement, but sometimes you just put a lot of cement and the cement tends to ooze out, right? It's like that. So when the fibroblasts are trying to heal the skin, they lay more collagen, and now this collagen is so much that the scar tissue becomes excess. Now it is hard, it is very thick, and this is called as a keloid. Generally, when this happens, there are two types of scars that can form. One is a hypertrophic scar, where in this situation also there is a lot of scar tissue, but here the scar tissue is well within the margin of the trauma. But in keloids, it is coming way beyond its limits. So in a nutshell, excess scar tissue that is way beyond the trauma line is called as a keloid. Most common areas where a keloid can form are the areas where there is high skin tension, which means, for example, if you just pinch the skin, it's very loose and lax, right? So the chance of keloid formation in this area are very low. But for example, in the areas like earlobe, where the skin tension is very high, the keloid chances are also very high. So the most commonest areas being your earlobe, chest, upper back. It can happen anywhere on the body, but these are the most commonest areas. So how do we address keloid? Firstly, it's always prevention is better than cure. So whenever you have a scar that is being formed or you undergo a surgery, it's important to take care of the scar in the initial days in order to minimize or prevent the keloid formation, right? And also, there is no guarantee way to know whether you are prone to keloids or not. For example, like if you have a keloid when you get your ears pierced, there is no guarantee that you will again form a keloid whenever there is any other scar. For example, you undergo a surgery later, you might come out of it with a very minimum scarring and no keloid at all. So it's very difficult to predict whether you are going to be prone for keloids or not, and we will only know that the keloid is formed after it is formed. So really what you can do is to make sure that you follow certain measures to minimize the formation of the keloid at your best, but otherwise there's no way to fully prevent the keloid formation. We can minimize and hope for a better scar remodeling through taking preventive measures. So what do we do? So when you have a wound, wash the wound thoroughly with soap and water, and then apply an antibiotic ointment if your doctor suggests to do so, and seal it up with a good petroleum jelly like Vaseline. It's very important to keep your scars moist and hydrated. Dry skin will only lead to very bad scarring. More hydrated and well taken care of skin will be having good prognosis when it comes to scars. So it's very important that initial days you take care of the scar very well by applying good amount of moisturizers and coating it all up with a petroleum jelly like Vaseline. So you wash the wound, apply an antibiotic ointment depending on how bad the injury is if your doctor recommends. Otherwise, just a petroleum jelly or a moisturizer will help in keeping the wound hydrated. The other good way of taking care of your wounds is to apply silicone. You can apply it in the form of gels that you get in tubes, or you can also apply silicone gel sheets. This is the more preferred method because it stays in place. It just gets stuck to the skin and slowly and steadily hydrates the skin for longer periods of time compared to the gels and the creams that you get. So applying silicone gel sheets also helps in keeping the skin, the wound area moist. None of these are going to interfere with the scar healing, but are only going to promote better wound healing. The thing that you must avoid doing when your scar is healing is to keep picking your skin, because sometimes what happens is the wound area can tend to become more itchy during this healing phase, and people tend to like scratch a lot and pick the skin. This is something that you must absolutely avoid. If you feel the skin is itchy, you can apply a moisturizer and rub around the skin, but never to scratch. And if it is very intense, you can consult your dermatologist. We will be giving you certain ointments that will help in relieving the itch, and in very severe cases and extensive wounds, we'll also be giving you certain oral medications to keep this itch under control. The other thing that will help you is pressure dressing. So for example, you get a ear piercing and you have any slightest doubt that you might end up having keloids, do pressure dressings. Like apply tight clip-ons, and if you have any surgery, make sure you do pressure dressings, and this has to be applied for prolonged periods, like at least 12 to 18 hours in a day you must apply. Lots of times we see that patients, yes, they say, yes doc, we're doing pressure dressing, but they're only doing it for like 3 to 4 hours, and that's not going to help. Pressure dressing for longer periods during the day for many days, as recommended by a dermatologist, will help in sort of better scar remodeling. So yes, pressure dressings will help depending on the site and extent of the trauma. Okay, now cut to 2 to 3 months down the line. You've done your best to treat your wound, but then you've ended up with keloid. What do we do? Well, again, it also depends on the severity, the area, and the extent of the keloid scar. So that different approaches. One of the earliest and the simplest ways to treat is to give intralesional steroid injections. Now, steroids when injected cause atrophy. So this is a good thing when there is bulky scar tissue, right? So we want the tissue to melt. We want it to become more soft, and that is what a steroid injection does. Depending on the severity and how bulky the keloid scar tissue is, we would be deciding number of sessions that is required. Usually more than one session is often required, with a gap of 1 month to 45 days between the sessions. Then the other treatment options are doing a resurfacing CO2 laser that helps in debulking the scar tissue, radiation therapy. Also, in sometimes very minor cases, we will also be doing microneedling RF, but I would prefer a CO2 laser over microneedling RF any day. Then the other treatment options are cryolysis, wherein cold liquid nitrogen is sprayed onto the scar tissue to melt it away. So these are all different options that are available. My personal approach would be to start off with steroid injections to see how much of debulking and softening of the scar tissue can happen, and once we've reached its peak, we will be doing resurfacing CO2 lasers. And surgical excision of keloid tissue can also be opted, but again there are very high chances of the keloid to recur, so it's very important to analyze the patient properly before opting for surgery. And even if we do the surgery, there is something called as, we don't do from end to end, we do in between. We excise the central portion of the keloid and then suture it together to minimize the bulkiness of the scar tissue. So that's a good option. Again, post this also we will be giving you silicone gel sheets, pressure dressings, and also opt for CO2 laser resurfacing. So usually what happens is more than one techniques is adapted together to give you the best possible outcome. Yeah, so this is all about keloids. If you have any more questions on keloids, please put them in the comment section and I shall answer them for you. If you found this video helpful, please do share it with your friends and family, and do subscribe to my channel.